Hi, this is Dr. Clark. I'm here with Stefan and Angela. And these guys, they're not from Texas. First of all, you'll probably pick that up in just a moment with their accent, although they speak very good English. So tell me, where are you guys from?
Yeah, thank you, Dr. Clark, for having us here. We are from Germany, and we flew in here 3 weeks ago to get a treatment that we could probably not have gotten in Germany. We noticed some issues with us, but didn't really understand all about it through our pastor in Germany, who was here about a year ago.
Just over a year ago.
And said it changed his life and saved his life. We understood that the body is a lot more complex than we thought, and that what we are experiencing is neither normal nor does it have to stay that way.
Oh, that's good. That's the most important part, is that number one, it doesn't have to stay that way.
Right.
And so, Angela, you came all the way to Texas also, and you've been working with us here in the office. Let me ask you first, what kind of things did you learn after you got here that led to why you weren't as healthy as you wanted to be?
Okay.
What factors were involved?
Right. So we had tried changing our diet back home. We tried supplements, but they weren't working. And so, we thought if you just change a few things, your body's going to heal up. One thing we learned, that if your body is struggling, if there's a lot of inflammation going on, that you need specific kind of supplements to kind of jumpstart your system, and then from that you can start, having a healthy lifestyle and buying good foods. So for me, I think a big issue was diet.
Yes.
That was a big issue. Trying out different diets, reading all kinds of books, low carb, no fat, and then, not paying attention to sugar. And I think that was one of the main causes so I came here for hormonal reasons, and I think that played a huge part. Avoiding fats and just lots of sugar, and not paying attention to the quality of foods.
No doubt about it. Just for our viewers' sake, I want to share with you, this happens a lot. You got some information, picked up a book, right?
Yeah.
And read a book on diet about and losing weight, I think is what it was. And it worked.
It
for,
did.
For that.
It
but
did.
Unfortunately,
Correct.
it wrecked her hormones.
Yeah.
And because it was low fat, and good fats are necessary for hormones, and it didn't take into account anything about sugar, so you could have all the sugar you
Correct.
wanted.
Yes.
And it just set off a cycle that unfortunately had a bad outcome. The other thing, though, do you think it would have been possible, with what you were doing on your own, to have found out about, like, how you were having the methylation issues?
Right.
Do you think you would ever, without knowing that, come to the conclusion, I need to be taking methylfolate, methylcobalamin, and all of these other things? That's why specific testing leads to then specific nutritional interventions, which make a difference, versus you'd already made some really good dietary changes that were important and necessary, but they weren't enough.
No, they weren't. And one of the first things I did is I went to a doctor, and they put me on birth control right away.
That's right.
And so they didn't address diet or lifestyle. I've mentioned a few things, that were happening, and they just said, go on birth control. It's all going to go away.
And it did.
It did.
But so did other things like your methylation.
Correct. And so that was, I kind of regret going to, an OBGYN to this day. But, I was, I think, 18 years old. Where do you go? You go to a doctor, and then whatever he tells you, you do.
Right.
And so, yeah.
It's the same. What you see, guys, here in the U.S. is you realize that it's not that much better other places either, because it's the same here. The treatment is very generic, and it's only to treat the symptom, and it doesn't take into consideration the other consequences. And that, unfortunately, is kind of what sets you off. And now, what about you, Stefan?
what we have been talking about this a lot and about our health issues, also the input we got from our pastor over the last years. What was important to me is I always saw it as a contrast between alternative medicine and school medicine.
Mhm.
School medicine, once you get in, especially in Europe, they want you to get out of the office within 3 minutes and they just prescribe some drug,
Yeah.
which maybe helps with the symptoms but doesn't get the issue off. So I knew if I go to the doctor, they're gonna give me some antidepressant, and I didn't want that, so I didn't even go. If I go to an alternative practitioner, he's gonna work around with some herbs, and I didn't trust that.
Yeah.
So when my pastor started telling me, he came here and he did intensive blood work for also a good amount of money.
Yeah.
I knew that that has some foundation,
Yeah.
and that works. So we shouldn't throw. My thought was, let's not throw science out the window just because school medicine talks about science, and also let's take what works, and the less chemicals I have to take, the better.
Yeah.
And that's what I got here.
Yeah.
Well, that's a profound statement. I just want to expand on that for a second because as a chiropractor, as a wellness practitioner, and integrative medicine, all those other things, they're all alternative, as you used, and people like to label us as being unscientific.
Correct.
Okay, but the fact is that in studies they say that 85% of all of medicine is undocumented or unscientific. In other words, it hasn't been proven by any reliable science. When he gives you that pill, you think that pill it's got all the research behind it that it
Correct.
really works, and we know what it does in the body, and that's really not the case. There's really more science to support the natural things that we do because we have to have more to back it up. But nonetheless, that happens here in the U.S. a lot. Is that they think they have to choose one or the other. They have to throw science out the window to go alternative, and you don't have to do that because functional blood analysis is absolutely critical to finding out what kind of proper diet and nutrition that you need to be on. Now, here's the big question. You've been with me for 3 weeks. You're going to be here one more week, and then you're going to head back to Europe, okay? Jump on an airplane. By the way, they won the award in my office this month for the longest trip. They were talking with another patient that came across town, I think like an hour and 15 minutes or something, and he was telling you about it.
And we flew about 12 hours.
Yeah, and he flew 12 hours.
Total flight time.
So, do you have information now that you believe that you can implement into your life that will help you in your recovery and be able to maintain that long term?
Okay.
That's my question. I want to ask you first.
Yeah. For me, there's two components. First, there's the general understanding about the body and how it works, and then there's information specific to me or to us.
Yeah.
And that is, applying all the general information and knowing what I personally need wouldn't have been possible just by myself and out of a book, although I started reading a book back in Germany about those issues. So together with both those types of information, we now, I think, know basically how to apply or how to change our lifestyle to stay in a healthy condition. That includes diet, exercise, which both of us haven't been getting the right kind of exercise our body needs, supplementation to a part, and it's not all about supplementation, I learned, and a couple other things.
Environment was a good thing we talked about.
Environment, what foods to buy, what do I need to buy organic and why,
Yeah.
and just basic lifestyle. And that's what I wanted. I wanted something that covers the whole life, the whole body, and not just covering symptoms again, or taking one thing out makes me feel better. I have that placebo effect because I did a big change, and it doesn't get the job done.
Very good. And you feel the same way?
Correct. So diet and lifestyle.
Right.
We were trying to eat healthy, but I think one thing we weren't really looking at, paying attention to what kind of meats we were buying.
Right.
And you mentioned that the grain-fed meat raises omega-6s,
Yes.
which was very high
Yes.
for both of us. And so paying attention to it, and the whole lifestyle. You know, we're gonna start with, you know, diet and what we've learned here, and then at some point even try to go and, you know, we were talking about microwaves yesterday, you know, how to avoid other toxins,
Sure.
you know, deodorants and what you put on your skin, that kind of thing. So we're heading that direction.
Great, that's
Yeah.
fantastic. So you mentioned a test that we did here. We did
Mhm.
the brain span test, which studies omega-3 levels and omega-6 omega-3 ratios,
Yeah.
and looks at blood sugar effects and some other things. And guess what? We found out that in Europe they got the same problems we got in America, which are a major omega-3 deficiencies
Mm.
and omega-6 toxicities. And the reason is what Angela mentioned is grain-fed beef in
Yeah.
particular, but also farm-raised fish and grain-fed chickens and things like that.
Yeah.
We've taken away the animal's natural diet, and now we're getting deficiencies and toxicities in certain things because of that. So
Right.
obviously we like grass-fed beef,
Yeah.
and we raise grass-fed beef. So, but it's a critical for every person to realize those are foundational issues to the cell.
Yeah.
A cell cannot function normally if it doesn't have the proper makeup of the membrane. And so that means your brain cells, that means your hormone cells, it means every cell cannot work normally. So thank you for taking time to tell us a little bit about your story.
Thank
It's
you,
been a
Dr.
pleasure
Clark.
working with you guys for the past few weeks and getting to know you, and I'm excited about the future. And so now from here, once you leave here, your healing is just beginning. You understand? And so the improvements that you experience now are the tip of the iceberg to what we hope to see in 6 months from now, and even up to a year or more from now. So as your body rebuilds, heals, and gets back to regular. So we need to follow up in about a month, and then in about 2 months we need to have some new blood work done. And if everything looks better and you feel great, then we know we're on the right track, right?
Yeah. Thank
All
you,
right.
Dr.
Thank
God
you.
bless you guys.
Thank you, Dr.
Thank you
Clark.
for listening. Live life well.